So I'm Karla. I grew up in Wisconsin, and then I moved away to Los Angeles and did all my graduate work out in Los Angeles, and then spent some time in North Carolina. And I have made my way back here to the University of Wisconsin-Madison, much to the delight of my parents that still live in northern Wisconsin. I'm an assistant professor at the university, and my primary area of work is in families who have children with autism spectrum disorder. And I'm very interested in the parent-child dyadic relationship and the complexity that occurs within that, and stress that often occurs around daily occupations, such as feeding, routines, and those kinds of things. My other role in the OT program here at Madison, and I should say I'm within the Occupational Therapy program and at the Weissman Center, is we work with the School Age Parenting Project in Madison. It's one of the alternative programs as part of the Madison Metropolitan School District. And we've had a long-term relationship with that program where our...
Sorry, I didn't mean to interrupt you.
Oh.
Could you speak just a little bit louder?
Oh, sure.
Okay, thank you.
Oh,
There's
sure.
a few people in the back, I think, with the food and the lunching.
Give me if you need me to go higher, sorry. And so our relationship, we have had a long-standing relationship with the School Age Parenting Project in Madison, where our master occupational therapy students go in, and it's a great experience for them, and hopefully we're also benefiting the program in some ways. And that relationship is how Karl found me, and we have been invited here to speak on mindfulness-based practices, practical strategies, and then we have also done some research within the context of the SAPAR program, and so we're going to present kind of a clinical example with a population that's probably not too different than some of the women that you're also working with in the larger Wisconsin area, and so kind of how our strategies worked and didn't work within that population. So I apologize, but I am going to use my notes because we do have some time restrictions, and I tend to talk a lot, so this will hopefully keep me on track. So here's an overview. We're going to just talk for a minute about occupational therapy. How many of you work with an occupational therapist currently? Okay. How many of you have worked with one in the past? Okay. How many of you have seen an occupational therapist for one reason or another? Okay. So we're going to take just a minute to think about why occupational therapy would be working in this practice area. Then we're going to talk about mindfulness-based practices overall, all the way from a very structured mindfulness-based stress reduction program that has a beginning and end to simple strategies that you might be able to actually start implementing tomorrow in your practices. We're going to overview the literature because there's a strong drive for evidence-based practices. It doesn't matter what your profession is. And so we need to be going back to the literature to think about what are we doing? Is there proof that it's going to possibly make a difference in our populations? We're going to talk just a little bit about yoga, some practical tips and strategies, and actually go through some activities ourselves. Then we're going to talk about guided imagery and pregnant adolescents, and that's the study that we've done, and we're involved with the SAPAR program here in Madison, and then a couple conclusions at the end. Okay? So first, occupational therapy. It's a profession that focuses on helping people participate in activities they need to do and want to do. Occupations are an everyday life activity that's meaningful to an individual. And so occupations are meaningful, and each one should be different potentially for all of us. So you can think about what might be meaningful to you. It might be taking care of your child. It might even be just being able to independently drive to work, going for a run in the morning. We all have different occupations that are meaningful to us. And you can imagine as a woman transitions into being a parent, those occupations change. And sometimes there's a loss and stress about the new occupations that are coming or the ones that they might be losing. So occupational therapists use therapeutic techniques to help people participate in activities they want and need to do, such as self-care, work, and leisure. They look at interaction of three areas: person or group, context, environment, and then the specific occupation. So they'll look at the individual who's participating in the occupation, or the person or group that they're part of, the environment that occupation is supposed to happen in, and the actual occupation. So it could be, per se, a new mom trying to breastfeed her child in her home, okay? And that might be an occupation we'd intervene in. And one of the reasons why we have a role is that we look at things that are barriers to participating in these occupations. And those barriers could be everything from something as concrete as to maybe it's a mother who has a history of breast cancer. And because of that, there's complications associated with being able or not being able to breastfeed, all the way to maybe a new mother who just has a really high level of stress. So there's many different ways, physical or emotional barriers to participating in occupations that we'd possibly look at. So in these high-risk populations, here's an example of one of the areas where we would work in a high-risk population. So in this study, there was African-American minority adolescents may be faced with chronic contextual or environmental stresses relative to their non-minority peers, in addition to the typical stressors that arise during the period of adolescence. So this is an area where we would think about possibly intervening. So these are some of the barriers that we'd address, as I mentioned before. Okay, so now we're going to jump into mindfulness. We're going to talk about mindfulness ranging from the structured programs, mindfulness-based stress reduction, which are typically an 8 to 10 week program. How many of you have participated in a mindfulness-based stress reduction program? Great. All the way to small interventions and techniques that you could potentially implement throughout the day, such as hand squeezes or things like that, to try and be focused on the present here and now. So we're going to start with the more comprehensive programs that really have the largest body of evidence to support them, and actually some have been modified to particularly support pregnant women. And then we'll move on to some of the more simple strategies. So the first, before we can talk about the program, we need to define mindfulness. How many of you participate in some type of mindfulness techniques or trainings? Okay, so some of you. So mindfulness really stems from the Buddhist culture, and mindfulness can be described as dispassionate, non-evaluative, and sustained moment-to-moment awareness. Again, moment-to-moment awareness of perceptible mental states and processes. Demands no comparison, judgment, or evaluation of these processes. The focus is on attention, awareness, and acceptance. It sounds simple, but can be very challenging. So mindful techniques may be a good way or a good tool in instances when meditation or medication and traditional interventions possibly haven't achieved the desired outcomes, or often used in combination with traditional treatments. So it might be used as a treatment in itself or a complementary treatment. When working with clients who have chronic or persistent conditions, mindfulness interventions may be cost effective, because most mindfulness interventions, once you move beyond the initial training, aren't high cost. So they can take the techniques that they're learned and they continue to apply the mindfulness practices for many years on. And in many of the mindfulness trainings, they actually talk about this, how you're going to learn this now, but you'll apply it as your life changes and evolves without having to take more classes or trainings. And another wonderful thing about mindfulness is it can address a variety of outcomes. So today we're going to talk a lot about perceived stress, but it can also be pain, self-efficacy, anxiety, depression. The outcome should be personalized for the individual who is participating in the mindfulness technique. Okay, so mindfulness-based stress reduction. It's usually a structured 8 to 10 week program with weekly group taught sessions that usually last around 2.5 hours, plus one additional all-day retreat session per course, typically taking place on a weekend day. Participants are usually assigned a 45-minute homework, usually a form of a mindfulness-based practice. The session topics include different forms of mindfulness meditation techniques, yoga positions, and social interactions. And hopefully this is sounding somewhat familiar to those of you who have actually taken a mindfulness program. These are the kinds of programs that you'll often find available through different health services and community resources that can be open to a general population, or they can be targeted. So I know that the UW Health program here in Madison has one that's specifically targeted toward teens. Okay. So the MBSR Sessions, each session usually has a formal and an informal component. Formal practices can include things like a body scan meditation, sitting meditation, hatha yoga, and walking meditation. Does anybody know what a body scan meditation is? Yeah? Most people do. So for those of you who don't, it's usually considered a mindfulness activity that is simply to notice your body. Not necessarily relax it, but notice your body in the here and now and where you are. And often relaxation can be a side effect, but it's really about being present in the moment with your body. Informal practices are awareness of both pleasant and unpleasant events, routines, communication, cognition and emotions, relationships to bodily sensations and habitual actions, and behaviors in everyday events. So next we're going to focus specifically on a mindfulness and childbirth and parenting program that used the basis for the mindfulness-based stress reduction but actually adapted it to the contents would be more applicable to pregnant and parenting mothers. And the cool thing about this program, it was developed by a woman who was in San Francisco, and in the last month she moved to Madison here at the UW. Woohoo! And she is very interested in taking this and integrating it around the state of Wisconsin in high-risk settings, such as schools that are designed for pregnant teens. So very excited about this. So we're going to go through this just a little bit to have an idea and walk through the different sessions of what an adapted program might look like for pregnant and parenting women. And again, this one is specifically identified for childbirth and parenting, but not necessarily adolescence. So I'll try and be clear when I'm talking about adolescents versus adult women. So the first session really focuses on the history of mindfulness-based childbirth and parenting and how they've adapted it from the traditional MBSR. And it introduces the themes, explores relationships between stress processes and change, and they do a mindful eating activity. And so this is one of the mindfulness practices that they start with, and there's a whole body of literature that talks about mindful eating. But really being in the moment and focusing on eating while you're eating and being a part of that experience. And so for the girls in this program, they do a mindful eating experience with the raisin. And I'm going to read a little bit on what they do to try and bring the raisin kind of to life and make it a mind and connect it to the experience of being preparing for childbirth and parenting. So using the senses of sight, smell, touch, and taste, this exercise serves to demystify meditation practice through the participant's direct experience of paying attention to one's unfolding, moment-to-moment experience. The theme of interconnectedness is introduced through looking at the belly button, the stem end of the raisin, seeing that the soil, sun, rain, clouds, and workers who picked and trucked the raisin all contributed to the health and well-being of their body and the body of their unborn baby through the nutrients in this raisin. So they take it even one step further. But you can think about, we're talking about the moment-to-moment experience. We were talking about seconds between when you put it in your mouth and you felt the raisin. So it slows things down. So this is the first step in starting to introduce them into how interconnected their bodies and are to the larger environment, as well as introducing as a first step in meditation, actually. Okay, so the second session then becomes a reflection on why are you here? The first formal meditation occurs, and they learn to perform the body scan. And the reality is that these meditation practices aren't easy for some of us. I know they are not easy for me. And so you almost have to learn how to do that and give yourself permission to participate in ways that are meaningful to you. The third session becomes really the shift perception of the childbirth experience is what they're looking to do. So they're trying to teach women to not necessarily being stressed from fear of childbirth or fear of labor. And they ask them to reflect on doing the body scan at home and practicing at home. And they assign 10 minutes per day of daily sitting practices. As they move into session 4 through 6, that's where they really start to teach yoga. They begin to teach practices to support pain management, sitting meditation, positions of labor, and they bring awareness to the specific stressors in life for those women. Next, they'll have their retreat day, as we mentioned, often occurs in a mindfulness-based stress reduction program, and that day is mostly silent, usually. And in this program, it's almost complete silence. And it's used as a day to deepen meditation and focus on living in the present. The 7th session moves into loving kindness meditation and thinking about opening your heart and well wishes towards others and reflecting on the retreat day they had. The 8th session moves in to focusing on how mindfulness can be used to establish attachment and bonding between the newborn and the mother immediately postpartum. And then the 9th session is they've done a cool thing with having the alumni who have graduated the program come back and talk about how they've been able to use the mindfulness to cope with the stressors related to having a new baby, and then they do an overall course review. So this is a great example of a mindfulness-based stress reduction program, but one that has been adapted specifically to deal with pregnancy, childbirth, and new parenting. So what makes MBSR different than other types of interventions? First of all, it does not have to be led by a mental health professional or held in a mental health setting, which is a significant key because there's often certain stigma that comes with those pieces. It can really be led by anybody who's trained to be an MBSR facilitator. It does not require the participant to be exposed to the content or detail of what they're trying to cope with, right? We're not asking them to relive their trauma, to work through it. We're asking them to be in the present, live in the now. So we're focusing on the moment-to-moment experience. Target population, who is this designed for? So everybody in the room, to the best of my understanding, is mostly dealing with pregnant women, but it's really meant to be an intervention that can be used with a wide range of participants. So you'll see intervention, and I think if you're recommending a specific MBSR program for somebody, it's important to think about this because the groups may be heterogeneous or homogeneous in terms of their characteristics. So you may have a group, as I mentioned here in Madison, that's specifically designed for teens, or ones that have been adapted to be designed for, like I mentioned, the pregnant women. And there's evidence of benefits for individuals suffering from chronic pain, fibromyalgia, cancer, anxiety disorder, depression, and the stresses of daily life. So there is a wide base of evidence to support MBSR. However, when you start looking at the individual outcomes, they're quite varied, okay, because it's used for a variety of outcomes. And part of that is because the outcomes are supposed to be specifically directed towards the individual who participates in it, right? Not all stress necessarily. So, is there any evidence for MBSR? It's the push for evidence-based practice to keep our funding, to keep our jobs, right? So we have to make sure that there is an evidence or a growing a base of evidence to these kinds of practices. And in some ways, I know when we first started looking at it, I thought these strategies seemed almost too simple in some ways to be effective, and was very pleasantly surprised to see numerous studies showing that MBSR can be effective for improving a variety of outcomes across different populations. And so what we're going to do today is just talk about a few studies that are either related to high-risk populations, as probably is most closely related to some of the individuals that we all have contact with, or specifically pregnant, breastfeeding, or parenting women. So this first study was done in MBSR for low-income women who had a history of post-traumatic stress disorder and a chronic trauma history that could be a wide range of trauma. There was 53 participants, and almost 70% were African American, with less than 10% having a high school education, and only 23 having a high school education, and somewhere else we're all in the middle. 74%, just under 74%, had an annual income below 150%, below 150% federal poverty line. So it was definitely a high-risk group. And so as we talked earlier about some of the general constructs that are addressed in mindfulness, such as awareness, so overall the studies found the participants reported they were increasingly more aware of themselves, others, their surroundings, appropriate boundaries with others, which is a big thing that we talk about in the SAPAR program. And throughout these, what they did to kind of highlight the findings is they have some quotes from some of the participants, and we'll give an example of some of the quotes. So for awareness, they said, "I enjoy being in the present because the trauma is not happening now. It is over. I'd rather be thinking about how good the coffee smells." There was a significant improvement of acceptance. That was expressed in the form of accepting aspects of the self, feeling accepted by others, tolerating others, letting go of past traumatic events, living in the present, and holding back the judgment of one's own self. "I am more patient as a parent because of not judging myself when I'm not being a good parent. I am able to step back from what is happening, to not get caught up in all the baggage." Another area of improvement was in the area of self-empowerment. Some participants felt they were more assertive, more confident, and they were able to open to taking more chances, and they were trying new experiences following the MBSR program. And again, this is after completion of a full MBSR traditional program, which led to improved feelings of self-efficacy. "I was victimized, but I don't want to be a victim anymore." So other areas of improvement were around in the areas of non-reactivity, decreased arousal, distress, improved self-care, compassion, and a sense of belonging and daily living. And you can see if you have improvements in these areas that we mentioned, how that might translate into being able to better activities of daily living and daily practices. So there was another study that we wanted to highlight that was specifically done on urban youth. And this was for programs who are for individuals who are HIV infected, at-risk African American youth between the ages of 13 to 21. And there was about 26 adolescents in this study. And the outcomes were around, they had a significant reduction in their hostility, a reduction in general discomfort and emotional discomfort, and they also had perceived improvements in interpersonal relationships, school achievements, physical health, and an overall reduced stress. And you'll hear us say perceived improvements, perceived stress, because often that's we're referring to, not that we don't believe them, but as it's being reported by themselves or a questionnaire. So it's how they're reporting they feel versus some kind of physiological measurement. And I'm not sure, did they talk about physiological measures earlier this morning? A little bit. So I'm taking a questionnaire, I'm telling you I have reduced stress versus measuring my heart rate variability or looking at my cortisol levels or electrodermal activity. Those would be more behavioral versus reported. Measurable, sorry. Okay. So there was another study that looked specifically at a mindfulness intervention for breastfeeding mothers. And the nice thing about this is that it was a randomized control trial. So in the world of research and funding, a randomized control is kind of your gold standard for designs, meaning that there's two groups of participants. One's randomized into the intervention and one randomized into the control. So it's the closest kind of design you can actually tell if there was a direct cause and effect for the intervention that was happening. And so this one found that after an 8-week mindfulness-based intervention for breastfeeding mothers, it was aimed to improve the maternal self-efficacy, overall mindfulness, self-compassion, satisfaction with life, subjective happiness, and psychological distress. And compared to the control group, the mindfulness participants scored significantly higher on maternal self-efficacy, certain dimensions of mindfulness, specifically observing and acting with awareness, non-judging and non-reactivity, and self-compassion, specifically self-kindness and mindfulness. And compared to the control group, they also had significantly less anxiety, less stress, and less psychological distress, which we know that benefits not only the mother, but also the infant. Okay. So now we're going to transition into some actual tips and strategies for doing mindfulness. So, I know that you're not occupational therapists in this room, but I know that you are all health professionals. And we think that these will be applicable to you as well because we're all working in similar types of populations. And so we want to think about strategies and consider some different variables that might be important to think about when recommending or talking about mindfulness interventions for individuals. So when we think about mindfulness activities, whether it be a mindfulness-based stress reduction or some of the other strategies that we're going to explore next, we want to make sure that the intervention will fit into the daily life of the participant you're working with. So we know that it's really hard to add something new to our daily routines. If you've read any of the habit literature, which it's been a while since I've gone in, how many times you have to do it before it actually becomes a regular habit. So we know that it's difficult to add things into our routines. And as much as someone may seem willing to comply with treatment or intervention, if it does not match well with their daily life, then it is unlikely that they will be successful with carrying out treatment. So we want to think about when we're making recommendations, whether it be for a full intervention program such as an MBSR or specific techniques and strategies, where that would fit within the person's daily life, and how we can talk to that individual about trying to plan and how they might be able to participate, do homework assignments if necessary, and how attending sessions may or may not be fit into their life. For example, for some of the work we do at SAPAR, transportation is an incredible issue. So how am I going to get there? How am I going to even get to school? So really simple, basic things that sometimes people maybe who are outside of this profession take for granted. We also want to think about cost. Some of these things cost quite a bit as far as the MBSR intervention sessions and where we're recommending to see if it would be reasonable for them to be able to participate in that. We want to do the best we can to think about the barriers ahead of time, even for the practices that we'd be integrating into the daily activities. And we have found particularly, and some of the research studies talked about it as well, is that we're more likely to participate in activities if they're held accountable for them. And how can they be held accountable? by working as a group, by checking in with somebody who's supporting them, possibly you all, to participate in the different activities. The accountability factor has hit Facebook, right? You're more accountable for your running and exercises routines if you're posting on Facebook and getting confirmation from it from your Facebook community. So how can we provide accountability in a comforting way to individuals that we're recommending to participate in mindfulness-based stress reduction programs or even simple strategies and interventions? We also want to think about considering getting trained in MBSR delivery or other mindfulness-based techniques. I am not trained in MBSR. I hope someday to fit that into the schedule as we're talking about and become trained. But I do think it's a great exercise to participate in, and it gives us a better understanding of some of the components that we'll be talking a little bit more about as far as the meditation, breathing, body awareness, yoga, guided imagery, when it's fit into a larger program. And it also has helped us to think about, even though I'm not trained but have participated in mindfulness-based activities, it gives more meaning to the individual practices when you know how they fit into the overall program. So yoga, we're going to talk specifically a little bit about yoga as well as guided imagery later on. So currently we're implementing guided imagery in the school-age parenting program for multiple reasons. It's easy, it's cheap, it's brief, it's worked really well, and we've found some nice effectiveness for it we'll show you later. But we also now want to think about doing yoga and use it as a comparison group. The girls are really interested in yoga. Yoga's trendy. You read about it all over. As I was driving over here, Monona Terrace, lunch, free yoga at lunch on Monona Terrace today. So it's available potentially in communities for free, for low cost. So I think that yoga is an interesting thing to think about it. And it can be adapted for different populations. It's frequently adapted for pregnant women. They have what's called chair yoga that often looks at connecting more with mindfulness, meditation, and breathing in your body versus some of the extreme yoga positions you have to think about. How many do yoga in this room? Handful? So when I was looking at the pregnancy yoga, it was way different than my vision of yoga, of what I think about my friends do. I don't do yoga. So it often focuses on breathing techniques, postures, strengthening exercises, and meditation. So there is quite a large body of literature as well thinking about yoga, which just to make sure that we understand, yoga can be a part of an MBSR program, so we'd call it like a mindfulness-based practice, not necessarily mindfulness-based stress reduction program. So there is a fair amount of literature to support this. And again, this first study was done, again, a randomized controlled trial. So again, that gold standard of research for effectiveness in high-risk pregnancies. It was found to reduce hypertensive related to complications related to the pregnancy, as well as improve fetal outcomes. Okay, so that's a big deal. So in high-risk pregnancies, again, it was found to reduce hypertensive-related complications related to pregnancies, as well as improved fetal outcomes. Okay, and it was a randomized controlled trial. The next one was looking at pregnant adolescents interested in yoga because they felt that they could build relationships with others who are experiencing similar stressors related to pregnancy, and it also helped with feelings of isolation, and it also felt it would help them with decreasing their stressors and depression. And this one specifically was looking at adolescents in urban areas to think about what kind of mindfulness practices they'd be most interested in. And they were very interested in yoga. And research on older teens and young women who are pregnant suggests that they're going to get information about abstinence, for smoking cessation and drugs and things like that. They'd rather have interactive activities versus one-on-one didactic lecturing. So yoga meant that component as well. The next one was looking at yoga was being effective in reducing risk factors associated with chronic disease. So body weight, blood pressure, glucose level, and cholesterol. And so looking at a number of other related factors. Yoga has also been used as a complementary treatment for a number of programs or other activities. So the first one was looking at, it's focusing on breathing and staying in the present, as well as being physically centered on oneself, and make sure it was mending with the mindfulness-based stress reduction program. The next one was looking at cognitive behavior therapy for quitting smoking. And it was individuals who did yoga and an 8-week group of cognitive behavior therapy had a significantly greater 7-day abstinence rate. An abstinence rate remained higher at 6 months of assessment and also showed the decreased anxiety. So that's when combining more of a traditional cognitive behavior therapy with more of an alternative practice such as yoga. And then the last one was looking at medical therapy and treatment of anxiety disorders. And they added yoga to that intervention, and yoga was found to significantly reduce perceived levels of stress in women who suffered from anxiety disorders. And it suggested that yoga could be used as a complement to the treatment or an alternative to the medical intervention. So we're slowly building a body of literature that I think will support using some of these as strategies in addition to the interventions that they're currently using, or possibly even as an alternative. And hopefully they'll explore both ways. Okay, so we're doing pretty good. So next we're going to talk about a few things and ways to start some simple mindfulness exercises. So remind me again, how many people practice mindfulness on a daily basis, a mindfulness-based practice on a daily basis? Okay, weekly? Monthly? Okay, yearly? Okay, so we have a few monthly people. Do you feel comfortable sharing what those practices are? Are you shouting out some of the practices that you guys are currently using?
I do body scans.
Body scans. Anybody use meditation? A little bit. So some people who haven't done mindfulness exercises, we think about ways to start that are simple and brief, and ways to start thinking about what mindfulness means, similar to the raisin activity. So one of the activities is a cause and effect activity. And we're not going to actually do this, but I'm going to have you think about it. Is because it's something that you can easily implement tonight when you get home. And I'd encourage you to take 1 minute, 5 minutes, 10 minutes, whatever you can do when you get home, and think about the cause and effect for something you do for a certain amount of time. And it needs to be simple, or it can be simple. So for example, on the way home, you get out of the car and you walk into your house. You walk to the refrigerator and grab a soda. Why did you do that? Well, you did it because you were thirsty. Why were you thirsty? Because you hadn't had anything to drink. Think about the cause and effect for the different activities that you're doing in the moment. And really focus on purposefully thinking about your behaviors and why you're doing them. Okay, so I'd really encourage you tonight to do that for 5 minutes, or even for one simple activity, thinking about the cause and effect of your behaviors. The next one is a hand awareness exercise. Okay, so I want everybody to have their hands free. Okay, make sure you're in a comfortable position for yourselves. And these are activities that we're going to talk about doing, but I'd also encourage you, if you're meeting with somebody, we do these with our students actually, if it's the day before an exam or the day after an exam, or they've just had a really intense class, we'll have our group of 25 master's students come in and they will be swinging from the rafters. And a lot of different faculty members now will implement 3 to 5 sometimes even a 10-minute mindfulness activity, either by a simple practice such as one of these, or even one of our faculty members has guided imagery recordings on hand that she'll play for the students. And we really would swear by, without doing any testing on it, that by losing that 5 to 10 minutes of class time, we gain their attention by getting them centered and focused on what's currently occurring at that moment. Okay, so I would encourage you to think about when you're meeting with someone, to think about if they're not present with you in that meeting, what are some of these strategies you might be able to do to get them present. So for the hand awareness exercise, grasp your hands really tight, okay, really tight as you can, and hold them for 5 to 10 seconds, focusing on your hands. Now release your hands and pay attention to how your hands feel. Keep your attention focused on the feeling as long as you can. Now, I hate to disturb the ones who are still focusing on your hands, but you can see probably that some people only seconds and some people were still focusing, and I disrupted you from focusing on your hands. So the activity will take on different meaning for different people. For somebody like myself, they're painting the lines, and unfortunately for you all probably for coming in, they're painting the lines in the parking lot, so I can hear them painting the lines. And for me, I really have to focus on, I hear them painting the lines, I need to come back to my hands. I hear them painting the lines, it's okay, they can keep on painting, I need to focus on my hands. So we all have different ways that we engage in these activities and giving ourselves permission and the people we work with in whatever way works for them. Okay? Some people really need that physical piece, so you can focus on a physical feeling. Other people, there's a mental focus exercise. So for this one, I'd like you to pick an object. So pick an object in the room that you'd like to look at, feel comfortable looking at, and stare at that object and try to remain focused on just that object for as long as possible. Keep a mental watch on when your mind starts to wander. Just as it starts to wander, bring it back to the object. The longer you can remain focused, the more your mindfulness will increase. Okay, so for some of you, you're probably starting to feel very uncomfortable after about 15 seconds, thinking how long before she's going to talk, right? And other of you may have been able to stare at a pop can or a bottle of water for an hour. Mindfulness is some people take to very easily, and some it feels very new age and uncomfortable. And so we have to be very aware of that. So when we use these practices with different individuals, being able to recognize not only their response to the activities, but our own responses and how we perceive and then present the activities. Sometimes what we've done is when we start a mental focus activity, our hand reassure particularly the pregnant adolescents, that we are just going to do it for 15 seconds and then we're going to bring them back. And sometimes I think it reduces the stress or anxiety about, well, how long before they're going to bring us back? So there's different ways to think about it, but I think these kinds of activities are good for us to examine our own perception of how we feel about different mindfulness practices. So for the next one, we're going to do a musical stimuli exercise. And this is one with the pregnant adolescents. We do a lecture to them and some group discussion around what some of their stressors are in their life. And we talk about how we all have stressors. Stressors are good and bad. And what's really important is coming up with positive ways and adaptive ways to deal with your stress, right? And so music comes up a lot because music is really important to teenagers. So I thought we'd go through a musical stimuli exercise. So usually what they'd recommend is listening to your favorite sound or song and pay attention to how it makes you feel. You can think about emotions, memories. You can engage in those emotions or not, see where they lead to or not, and really focus on that song. So I tried to think of a song that when you listen to, you would be able to recognize it, and it would be stir some emotion for individuals. So So I'd like you to listen to the song. I know it may not be your favorite song, but hopefully it's a song that evokes some emotions or is in some way familiar to you. And I'd like you to pay attention to how it makes you feel with memories, emotions, and where the song takes you. And if you'd feel comfortable afterwards, I'd love to get some feedback on that. I think part of the reason I picked it is it first was released at a 1991 Super Bowl, and I remember actually where I was sitting. So when I start listening to the song, I see myself sitting on the stairs in this basement, and I was in the kitchen making food, and I really like Whitney Houston. And so I remember running down to sit so I could watch, taking a break from the food preparation because I really wanted to hear her sing. And I remember sitting in that stairway sobbing because I just thought it was such a beautiful rendition. And because it was such a meaningful moment to me, even when I picked the song and pulled up the YouTube video, I just get goosebumps because it was just a really meaningful song. And it was released as a single after that. And then the other reason I find it very meaningful for myself is the second time it was released as a single. Does anybody know? Not after her death.
9/11?
After 9/11. So it was released again after 9/11, and to me, then it just created and extended this meaning and makes me think a lot about different things. So you can see how songs have different meanings and emotions, and this song creates a certain sense of meaning and experience and vision for me, and very different for other people. So you can imagine if we each picked our own song, how that could potentially be a very mindful practice for us and help us really sit in the moment for what we're doing. Okay, so we're going to go through next. I talked a little bit about resources. No matter where you are, I can guarantee you there's mindfulness resources. The UW has a number of really nice online resources, and there's tips on stress reduction and stress management, as well as guided audio relaxation exercises. Kaiser also has a number of online audio relaxation programs, and I would recommend going to some of these medical systems through their larger websites versus you're going to find all kinds of crazy stuff online. The Madison Area Technical College also has programs and resources, so you're going to find stuff. And there's so many different extensions throughout the state. There's going to be resources there as well. And they often start with things you can think about managing stress and anger. So don't talk about mindfulness. Talk about we need to manage your anger. We need to manage some of the stress because it's going to make your life better and your children's life better. So anger and stress, not mindfulness, is sometimes how we can approach it. There's also a number of resources like Mindfulness for Dummies, right? So they've tapped into popular culture, and you can get this on Amazon for $15 and other places even cheaper, okay? And these are kinds of things that help us in the community who aren't trained in mindfulness-based stress reduction practices, but want just to have little pieces of information to offer people we work with and strategies. And I think we need to buy in ourselves. I know that until I bought in, it was harder for me to work with the pregnant teens doing things until I really jumped on the boat. Okay, so now we're going to do a quick overview of the program that we're doing with the school-age parenting program here in Madison. And it was guided imagery and stress in pregnant adolescents. And there was one of the students, Terry Flynn, who's on her second fieldwork as well, was instrumental in running this study. And so I want to make sure I give her credit, even though she's not here. The school-age parenting program, as I mentioned, is an alternative program in the Madison area school district. Dr. Mary Schneider, who you may or may not know, is professor emeritus at the university, and she started the program, I think, 20 years ago. And they started the relationship because she does work in primates, looking at the effects of stress, alcohol, and intense sensory experiences on pregnant primates. Okay, and so they contacted her to start talking to the family, to the pregnant teens in the program. And so from that, we have continued to expand the program. So our students go into the classroom and we do an interactive nutritional eating activity. They make their own smoothies. We try and think about things and ways to promote healthy eating that are realistic with the economic constraints and the social constraints that a lot of the pregnant teens have and are in very high-risk situations. So we do nutrition activities. We also do a really cool brine shrimp activity where we have the pregnant teens grow brine shrimp in a saline solution, an alcohol solution, and a half alcohol solution, and we see which ones hatch, which ones half hatch, which ones maybe hatch with one leg, and have them then 2 or 3 days later after they hatch, they come back and look at them and see what happens when you grow things in varying environments. We also do a lecture before we do the guided imagery intervention where we talk about the effects of alcohol, drugs. We often talk to the teacher at the very beginning of the year and see what are the new trendy drugs on the market or have been in the press. And then we talk about the effects on that with pregnant teens. And then another thing that our students participate in is they have a wonderful event at the Madison Children's Museum that they close the museum and to the public, and they open it up for pregnant and parenting teens and their extended families. And so then at that event, we do some craft activities that are made for the parent and child to participate in together. They're purposefully designed to be too difficult for the child to do alone, so they need their parent to help. And then we also do a scavenger hunt through the museum because we found the very first event, the teens weren't even exploring the museum. They were kind of staying in one area. And so we did a scavenger hunt where they have to go answer developmental questions around what age should my baby start walking? When should I expect to hear 2-word phrases? And then if they got stamps from all the scavenger hunts, they got to come pick a prize from the bucket. And it was things that I picked up at the dollar store, and you would have thought that they were each worth $1 million. So those are some of the activities we do with the program, and I think we gain as much or more than the students in the program, the pregnant teens in the program. So another thing we do is we look at guided imagery intervention for the teens, and so this is specifically about the results of that program. So we know that teen rates are overall declining across the United States. However, they are still high enough that they warrant significant concern. And if we would look at the numbers, it still would be that over the past 2 decades they've declined, but there's over 270,000 children that are born to teen mothers between the ages of 15 and 19 in the United States in 2013. And in the SAPAR program, we have children as young as 13 and sometimes 12. So we know that those extend even lower than that. And last time I looked in Wisconsin, and maybe you guys even know better than I do, but the teen rates were declining overall, but there were certain populations of minorities that was actually increasing. Okay, so they might be declining in white women and women who are African American, but potentially increasing in other minority populations. So we still have a big problem. Teen pregnancy and stress. So we know that although the rates are declining, it's still important to address because during adolescence, the adolescent pregnancy can intensify the typical stressors that pregnant women experience. So you all mostly work with not teens who are pregnant, right? Any age. So some of you are working with teens. Okay, great. So adolescence is a transitional period from childhood to adulthood that's often associated with high levels of perceived stress anyway. And adolescent females are more vulnerable during this transition than their male counterparts, which has been strongly supported by research. And that pregnant adolescents are likely to experience high levels of stress due to economic strain, family stress, risk of medical complications, decreased peer social supports, and interrupted development. They also face the dual role change of child to adult and daughter to mother, which I think is a really big emphasis or a really important point. So they're going from child to adult as well as daughter to mother. Furthermore, the lack of support due to the stigma surrounding teen pregnancy often further increases the stress. So we can think about that there's high levels of psychological stress in pregnant teens are associated with lower gestational age at birth, which means there's a higher risk for premature birth, which you probably all know. So many of the babies in the SAPAR program are born early or born small. There's additionally high levels of cortisol in pregnant teens. The high levels of cortisol in pregnant teens are often related to low birth weight. Okay, so in correlational studies, that's what they've found. So low birth weight infants are more likely to experience decreased growth, hyper-responsive reactivity to stress during infancy and childhood, and low birth weight infants are also an increased risk of developing depression and anxiety in adolescence. So we really try and frame to the girls that we're looking at this not only to support your decreased stress and well-being, but also the long-term effects on the child that can be actually into adulthood. So prenatal stress and anxiety in pregnant adults are associated with delayed fetal nervous system maturation and reduced gray matter in children's brains, making them more vulnerable to cognitive and intellectual impairments, as well as neurodevelopment and psychiatric disorders. So there's significant research that it actually affects the brain development. Children born to adult women that experience high levels of prenatal stress display cognitive and motor impairments as early as 8 months of age. Okay? And so this fact was for adult women, not necessarily pregnant teens. So this would be across the populations you're working with. Known psychological and psychosocial effects of stress during pregnancy include temperamental and behavior problems as children, as well as an increased risk of ADHD and anxiety. Therefore, high levels of stress during pregnancy can negatively impact a child's development, with effects lasting into adulthood. So we decided to use the guided imagery in this group for a number of those reasons that we feel are supported in the literature to move forward on this, using this technique. So guided imagery is a relaxant technique that uses spoken word and calming sounds to lead users to envision being in a relaxed state. It has been found to reduce both physiological and psychological stress in adult pregnant women. So there actually is a nice but small body of literature to support that this is effective in adult pregnant women. But we don't have any literature until now to start thinking about if it could be effective in adolescents as well. Okay? So, and one other piece that's really interesting regarding this is that there is actually some limited research using fetal monitoring that would indicate there's physiological changes such as decreased fetal heart rate and suppression of fetal motor activity while a pregnant woman participates in guided imagery. So they suggest that the fetus potentially is participating in the maternal relaxation. Okay? And again, this is an adult woman. So the purpose of our study was to think about, can we examine the effects of guided imagery on perceived psychological stress in pregnant adolescents over time? We hypothesized that the guided imagery intervention, based on previous research, would reduce stress in pregnant adolescents, so hopefully applying what we've learned in pregnant women to the adolescent population. So we used a quasi-experimental one-way repeated measure design. There was 44 students that were recruited in 2 different sampling waves. The inclusion criteria was pregnant females ages 13 to 21, and they had to be enrolled in the SAPAR program specifically. If they delivered prior to completion of the intervention, they were excluded from the results. This, of course, was approved by the UW-Madison IRB as well as the Madison Metropolitan School District. We used a measure, the psychological stress measure, the PSM-9, which is a Likert scale questionnaire, and it has really strong psychometrics in pregnant women and in college students. So we thought that would be a good measure for us to use for the pregnant teens. So for the purpose of this study, we define stress as a state of psychological tension related to both positive and negative events. And that's one thing we really stress with the pregnant teens, is that stress can be positive. Like a baby shower, it still can create stress. And different types of circumstances related to those events, which is consistent with the definition that was proposed by the PSM-9 people. So for the intervention, each participant was given her own MP3 player. They all listened to the same 12-minute, 51-second audio recording of pregnancy-specific guided imagery at 4 times during their pregnancy. The goal was for each participant to listen to the recording 1 time a week in a structured setting for 4 weeks. However, though, we work with similar populations, and having people show up at school and participate wasn't always the easiest task. So in the analysis, we did co-vary for the number of days it took to actually complete the intervention. A research team member would provide instructions, a brief overview of guided imagery, and strategies for participating in the GI before each participant's first session. And then the remaining 3 sessions, they were given a note card with a brief description of guided imagery and related benefits, as well as tips on how to focus, such as, when you notice your mind wandering, acknowledge it and refocus on your breathing. During each listening session, the researchers tried to minimize distractions, and participants tried to make themselves comfortable and focus on recordings. And that meant trying to get them to not look at their phones. Interpretation. Confiscates the phones. So each participant was given the questionnaire before and after each session. We used the total score. There was less than 2% missing data. and we averaged the scores for any kind of missing data, and ANCOVA was used. If anybody wants to talk about that later, I'd love to do the testing. And like I said, we covariate for the number of days it took to complete the analysis. So the results. We had 35, we started with 44 pregnant females. We ended up with 35 because 9 delivered during the context of the intervention, which isn't surprising because SAPAR, usually the girls attend the program for 2 semesters. They come in sometime during their first or second trimester, usually give birth, and then they come back and finish up the next semester that they're in. They do get a short period release from school, but then they bring the baby to school for so many weeks. And then there is an on-site childcare that has a certain number of spots for women in the SAPAR program, and otherwise then the children are at other daycares for the rest of the time. So we did find significant effects within the session change in stress and between session. And I'll go over that on a graph and what that meant. So the blue is the pre-test and the red is the post-test. And these are the mean scores for the stress questionnaire, okay? So this means the first session, their pre-test was right around 34, okay? So they listened to the guided imagery, and it went down to about a 23. So then next week we come, and they're allowed to use the guided imagery between sessions if they'd like. We leave the MP3 players there. We were not able to keep good track of how many and who was using it in between sessions. We did not allow them to take them home because we didn't think we'd get them back. At the end of the study, they were allowed to keep the MP3 players, but during the study, they needed to stay in the context of the classroom environment, but they could have access to them as they wanted. So session number 2, they're starting at a lower stress level. They're at 30. They go down to about the same. Session number 3, a little bit lower. They go down, and session number 4. So we see a nice decrease over time, but what's interesting is we're seeing a decreased stress perception before the intervention, and we're going down, we're kind of plateauing here at the bottom. So then we thought, well, what's going on? Where are we finding the significant difference? Because we know there's a significant change, but between which sessions are we finding? So meaning between the first and second, second and third and fourth, what are we seeing? Okay? And so what we found is that there was a significant difference in the change and reduction in stress from time 1 to time 2. Okay, so that's a significant change. Because just because a point lowers, it doesn't mean it's significant. And if it's not significant, nobody cares. Okay? So we found a significant change in their decrease in stress between time 1 and time 2. Significant between time 1 and time 3. And significant between time 1 and time 4. So really what happened, we saw them reduce their stress after the first intervention, and it continued to remain low. Even if it did slightly decrease, it wasn't enough to continue to be a significant change. Okay? And the bottom just kind of flatlined. So what does this mean then for as far as the results? So the preteens experienced short and long-term stress reduction during the intervention with effects diminishing over time, right? Because we saw a big change and then it kind of flatlined. The largest reduction with stress occurred within the first listening session and decreased with each subsequent session. Stress was cumulatively reduced across all 4 sessions, right? So we know from the beginning till the end, it was reduced. The amount of stress reduced between session, though, was diminished. So we had a big reduction between time 1 and 2, and then it was smaller for the next few times. So what does this mean? So after seeing the results, we were really glad that the girls' stress is reduced over time. And we saw the pre-test scores decreasing, but the post-stress levels remained relatively constant, okay? And what I'm talking about here are these post-stress, right? So we're not seeing, like what you may have hoped is that, oh, we're at 23, well, now we're going to go down to 20. Now we're going to go down to 19. Now we're going to 15. But we didn't see that. We saw them just kind of plateau. So it began to question, is there a threshold for how much this intervention, meaning guided imagery, can actually reduce stress in this population? So maybe with guided imagery, this is as good as it gets. We can only reduce stress this much, and we just can't get it any lower with this specific intervention. Or maybe it's because of how we were administering, but there's some kind of threshold potentially with what we were doing. Do we think that a 13-minute recording, the other question becomes, was actually reducing their stress over time? Or was there actually a cumulative effect in conjunction with some other types of intervention? So we really questioned, why were they having such a large stress reduction before doing the guided imagery? Any thoughts? I think that's it. So the girls were in multiple different trimesters, right? So it wasn't like we thought, well, could we break them up to see, okay, well, are some girls, moving into their second or third, seeing if the trimester made a difference? Was it age? We couldn't figure it out. And I think what was happening is that in anticipation of doing the guided imagery, they were already starting to calm down and relax and decrease their stress. That just doing it once, they were really high, and then they did it. They might have even been anxious about what we were going to do. And then they do it, and they're like, this is kind of nice, right? And then the next time they're like, I remember this, and this is kind of cool. We do it again, and we see a nice, big, significant change, okay? So we think that they might be anticipating the change and anticipating the intervention. And in some ways, it matters and it doesn't matter, but we know that they had this nice reduction over time. We also, question, depending upon the program, whether other external supports that we've been put in place at SAPAR that were helping reduce the stress, because they're clearly a program that's catered to pregnant women. This anticipatory effect is kind of what we're thinking. So, clinical implications, we would suggest that the findings in the study have significant implications for occupational therapists as well as other allied health professionals to apply their expertise in lifespan development in this emerging area of practice, because I don't think enough people are thinking about practicing with pregnant teens, and it's such an important area of practice because you're working with mothers and children, so you're working across the lifespan. I mean, we're affecting multiple people's lives with one visit, which I think is kind of cool and such an interesting area to be working in. Guided imagery practices may be integrated into an adolescent's daily routines prior to particularly stressful events or after one has occurred to support the reduction of stress and promote well-being with benefits for the mother and potentially her unborn child as well. We may be able to provide insight as to when and how a guided imagery intervention may be beneficial to support carryover into real-world situations. Okay, so one thing that we were hoping to potentially implement is that if this does create this short-term stress reduction for girls, is there a way we can start having them self-reflect on, I'm going to go to this doctor's appointment and it's going to be really stressful, terrible, or I'm going to go visit this family member and it's going to be horrible, or somebody's coming home from work. Is there a way that we can help them place guided imagery so they reduce their stress before they engage in activities that they know are going to be really hard for them to manage? So that'll be one of the next steps, to see if we can get them to integrate it in ways that are beneficial, knowing that it's going to reduce their stress. Also, we're going to try and add a yoga comparison group to see how they respond to that, if it's more effective at reducing stress. And again, if that's something that might be a way, because MP3 players, I mean, it's only a short recording, but you still have to have it to listen to. So we think with something with yoga, maybe there could be a piece of it where we could just do some deep breathing exercises. So they're in the middle of a doctor's appointment, they didn't expect to be stressful, they can't pull out their MP3 player and listen to a 13-minute recording, right? But maybe a small piece of yoga they could do. So we're going to add a control. We're going to think about the environment. The study was done very well because it was in the context of the school day. But as you talk about chaos, fire drills, phones, bells, drama, we had it all. So the environment was challenging, but actually very translational. And we want to think about other outcome measures in case there is a floor effect for what we were using. Thank you. I appreciate your attention and your alertness after lunch.